This statement is one I also like to show, and it says we have a great deal of government in regard to health matters, but it is local, unsystematized, and often conflicting in different sections of the country, etc. You can read it. Most people, when I put this up, think, gee, that was published in the last 5 or 10 years. That came out of a special section of the Journal of the American Medical Association 100 years ago today. Things have not changed much. During President Bush's last days, or I should say last year's, a little over a year ago, we put this health security presidential directive out. The only reason I show this is it's extremely important to where we're going in the United States with this whole evolution of education and training, developing a discipline of disaster medicine and public health preparedness, and hopefully developing a system. And it can't be a system that just operates within the United States. It has to be interdigitated and interrelated in a global way. The heart of being ready is planning. Even if you can't predict what might come, the very process of planning gets you to meet the people you have to meet. It gets you to exchange those business cards before an event. It makes you think of the things that you have to do in your particular sector. This just gives a feel for the enormity within the United States. If we were to get our training programs out to every medical first responder that's recognized, it would be over 10 million people, or approximately 3.5% of the population. This is something we believe in very strongly. I don't want to get academic with you, but basically all of our courses going forward will be based on a set of standard competencies, so that you will have a competency to understand infectious diseases, a competency to respond to a waterborne type of infection, etc. And if we have a common understanding and education built on similar competencies, we'll be able to work together much better. One of the best examples of that I think of when you get involved in a biological event and you call a terrorist, that means the FBI comes in and they want to do surveillance, and then you go talk to the epidemiologist and he wants to do surveillance. They're really talking totally different languages, and we need to overcome that. I flipped through the competency slides because it's late and I know people get drowsy, and I do not want to interfere with your break. This goes back to planning, and not planning by fear, and not planning by single focused events. And it really, up here we have a biological event, a chemical event, a nuclear radiological event. Water's not up there, but any of those, as was pointed out by Patricia, can happen in water. Along this axis, it might be an event that involves 10 deaths or 10 injuries, and of course the scale goes up. The reason I go through this is to show the complexity of trying to predict a specific event. One of the most important things we've come to realize is the geoclimactic. Where did the event occur? Did it a sub-freezing temperature? Did it occur in a place where water is scarce already and what was there is no longer available? All of the different disciplines that get involved. But this is the take-home lesson as far as I am concerned. I don't care if it's biological, chemical, radiological. I don't have to plan differently, because it's this bottom axis. No matter what the event, you're going to get a distribution of casualties or patients, or carry respiratory diagnosis, trauma diagnosis, burn diagnosis, dehydration diagnosis. They won't be the same numbers. There'll be different coefficients in different events. But this gives us a much better way to plan across scenarios instead of looking at single scenarios, which are often inspired by fear. And I'm going to start to wrap up here because I know time is precious and we will not interfere with break. About 2.5 years ago, we started a journal. I'm privileged to be the editor-in-chief of this particular journal. It is a peer-reviewed medical journal, but our editorial board has modelers, environmentalists, psychologists, nurses. We cover the spectrum of all of the disciplines that have a significant role to play in preparedness and response. And for those of you in the audience that may have a bent towards publication, editing, etc., we really are looking for an extension, a greater extension, into the global arena. Leadership in this area is the most important thing. And this is the state of leadership at least a couple of years ago when I first found this beautiful quote. There go my people, I must find out where they are going so I can lead them. And this is obviously inverse, upside down, whatever terminology you want to use. But so many of our efforts are catching up with the pack, trying to figure out what's going on, and then assuming some kind of leadership of it, instead of identifying what's needed and pulling the pack along. We have leaders by position, profession, and personality. Too often, our leaders by position are appointed politically. And you can see often the results, such as the performance of FEMA in Katrina, when you have people charged with making decisions that don't have the tools and the expertise to make the right decision. I have one more slide after this, but this is an old quote from Henry Ford. And coming together is a beginning. And in this area, coming together here is a beginning. Next, of course, is keeping together, is creating an initiative. The really difficult one is working together. And this, I will finish off with where I started, some commentary on an approach to water in terms of prevention and response. This is a pandemic response countermeasure diagram that we've developed to show the multi-layered approach that you have to take when you're going to protect the population. On the outermost circle, you want to decrease exposure. If you know something is contaminated, if you know someone has the flu, you want to limit, through social distancing, etc., exposure to that. At the second level, when something has actually occurred, when somebody gets infected, then what you want to do is decrease infection. In the flu example, you decrease infection through proper immunization and vaccination. That's not always available early. In the third circle, you want to decrease morbidity. And in the fourth circle, decrease mortality. And those are specific countermeasures such that you would give antibiotics and IV solutions for cholera from a waterborne infection, etc. I think you need to develop this kind of a framework of multiple answers if you're really going to come to grips with a problem as complex as water systems and the multiple scenarios that can emanate from intentional or accidental contamination of the water supply. And I will stop there. Thank you.